Good afternoon. I'm Dr. Mark Hochmann from Milestone Scientific. I'm the Director of Clinical Affairs for Milestone, and what we want to discuss with you today is an exciting new product called the STA system, Single Tooth Anesthesia. This product is actually the second generation in the computer-controlled local anesthetic delivery system category. We first launched our first initial product called the Wand back in 1997. This is really the next generation to that entire concept. What we've done is we've developed a new technology called DPS, Dynamic Pressure Sensing Technology. What does dynamic pressure sensing technology do? It gives you real-time feedback to allow you to know when you're in the right location, when you're in the wrong location, and allows you to give an injection virtually painlessly. Any injection you currently give, you can now give better. But there are several new injections, never before that you could perform. Using this technology empowers you to give some new injections that you can't give with a handheld syringe or any other current technology. Let me show you. The unit itself has several different modes. It allows us to have this wand handpiece, which is featherweight in its weight. It has a superior ergonomic feel to it and tactile control. You can do many different things with this handpiece, but one of the great things you can do is actually remove the tubing to shorten it. So for certain injections, like an intraligamentary injection, you can now customize the handpiece. Now when you're performing an intraligamentary injection, the hardest part of that injection is knowing when you're in the right location. Now with the STA system using DPS, you know exactly when you're in the correct location. All it requires is to position the handpiece with the needle into the sulcus, and as you activate the system, you'll see that you get real-time feedback. That real-time feedback is audible as well as visual. So here you can see the pressure is building. If I move the handpiece, you can see the pressure drops. So now for the first time, we know when we're in the right location, maintaining the right position. So I'll slide the needle back into the sulcus, and you'll see that the pressure is building. Once you've positioned the needle in the correct location, all you now need to do is just maintain it in that position. After 8 to 10 seconds, you'll hear the unit will actually tell you when you're in the right location. You administer a quarter of the cartridge, and then you can work instantly to perform that procedure on that single tooth. But in addition to performing single tooth anesthesia, you can perform all the typical injections that you give, an infraalveolar nerve block, a buccal infiltration, as well as some new palatal injections that we developed using this technology. Two new injections that we developed, myself and my colleague Mark Friedman from California, is the AMSA, the anterior middle superior alveolar nerve block, in which we place the needle on the palate and we can anesthetize 5 maxillary teeth from a palatal approach. So now what we can do is we can do restorative aesthetic dentistry in the maxillary anterior part of the mouth without having the droopiness of the lip. And this is a virtually painless injection. In addition to the AMSA, we also have a second injection called the PASA, a palatal approach to the anterior superior alveolar nerve, in which by placing the needle into the lateral aspect of the incisive canal, we can perform an injection that allows us to anesthetize the 4 incisors. The technology was developed to enable us to give virtually painless injection. That was the predicate device, the wand. Over the years, we saw there was a terrific need to allow dentists to perform some newer injections, particularly the intraligamentary injection. And what we were able to do is develop a new technology that has perfected the ability for us to identify the right location and produce pulpal anesthesia for a single tooth. If you want, you can perform the traditional injections, such as an inferior alveolar nerve block, because the handpieces that we have all the same needles that you typically use in dentistry. The 30 gauge 1/2 inch, you can use a 30 gauge 1 inch, as well as a 30 gauge 1 1/4 inch needle in a pre-bonded version, as well as using standard medical Lorlock needles. So now you have an armamentarium that allows you to perform all injections in dentistry very, very effectively, as well as some new injections that you previously couldn't perform. The major benefits for your patients are that it's virtually painless. Your patients become much more enamored and can focus on their daily task without having to leave the dental office with collateral numbness to the lips. The major benefits for the practice is that it becomes a very big practice builder as other individuals within the practice find out that you're using this technology, as well as the benefits for you as the dentist, allowing you to perform, which typically is the most difficult part of the dental procedure, is local anesthesia. Now you can find that this part of the procedure is actually very comfortable for you to perform. In fact, many dentists tell us this becomes the least stressful aspect of performing dentistry, performing local anesthesia. So I think that the technology that we have and we've developed for dentistry is very, very exciting. We've done very well, not only here in the United States, but internationally. And incorporating this technology into your practice, we found is a very, very invigorating practice builder for all individuals, no matter what type of dentistry you're performing. So I hope you take the opportunity to review the technology, contact your distributor, or come to one of the dental shows and have an opportunity to see what this is all about. We've been in business for 10 years, but this product is our new flagship product, the STA single tooth anesthesia device, allowing you to perform all injections at a much higher level and sophistication. I want to thank you for listening, and I look forward to meeting you sometime in the future. Thank you.